to be really careful about this x-ray. Let's go through the case. So it's important to go through the x-ray systematically. First, let's have a look at the clavicle. That looks okay, I can't see any fracture here. Then we'll move on to the ACJ, or the acromioclavicular joint. The acromion is part of the scapula, and the underside of the acromion should line up with the underside of the clavicle, and that's the case here. If you find the clavicle is being displaced upwards, then you could have ACJ dislocation. Make sure there's no glenohumeral dislocation and the humerus lines up with the glenoid, which is part of the scapula, and that's okay here as well. Don't forget the chest. Have a look at all of the ribs and outline these, and also look between the ribs at the underlying lung. If we do so, we can see there's a lack of lung markings between the second and the third rib. This isn't typical for a pneumothorax where you'd expect lucency, as here there's an opacity, so we have to suspect that there's an underlying mass. If we look closely, we can just outline a mass at the lung apex. Given this is such a young patient and it doesn't look destructive, lung cancer is probably less likely, but we should consider a neurogenic tumour and a pleural fibroma in this case. Here's a coronal view of the CT scan, and this confirms there is a mass here at the left apex of the lung. The lesion was resected and was confirmed to be a schwannoma. The learning point here is to never forget to look at the lung on every shoulder x-ray you look at.